stress, and you guys don't have to stress, and staff doesn't have to stress. All right, let's get started. So, good afternoon. Welcome to voting list number 15. Today's Tuesday, April 2nd. This is the Health and Government Operations Committee, and just for the public, a lot of these bills we have seen already. You're gonna see us rush through them, but we have already studied them, had them in for hearing, subcommittee, then the whole committee, and we know them. So we're going to rush through them, especially if they're identical. So don't think that we have not studied or have not learned them, okay? So we're gonna start with Senate Bill 13, Public Health Maryland Pediatric Cancer Fund and Commission. It came out of subcommittee favorable with amendment. It is Aaron and Bagnall. Aaron.
This is the bill that establishes the Pediatric Cancer Research Commission to oversee the award of competitive grants from the Maryland Pediatric Cancer Fund. It also limits the authorized uses of the fund to providing grants to eligible applicants to conduct pediatric cancer research only. Since the bill has crossed both chambers, there have been additional changes made. In the amendments, they authorize up to 5% of the fund, along with the promotional account to promote donations and public education, to also be used to administer the fund, including staffing. And then the amendments clarify the membership of the committee by removing references to specific institutions or medical systems. That was in response to potential conflicts of interest. And it also requires the commission to develop criteria and a process for reviewing grant applications.
Okay, Bagnall.
It was not in subcommittee.
Okay, that's right. We have had it before. So are there any questions regarding the amendments? Delegate Bagnall?
Madam Chair, no questions. I just wanted to say that this is a technical amendment to clarify a concern of perceived conflict of interest.
Okay. The amendments have been moved in second. Any questions or concern? Seeing none, all those in favor of the amendment say aye. Aye. Any opposition? Seeing none, on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. It's unanimous. Senate Bill 59, Hospitals Care of Infants After Discharge, Safe Sleep Act of 2024. It is favorable. Aaron and Bagnall. Aaron.
It is identical to what is not listed as a cross file, but is essentially a cross file.
Again, we have seen this bill already and we know it well. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's move on to Senate Bill 117. Aaron, it's the same one.
So this bill repeals the requirement that the Secretary of Health and the State Advisory Council on Hereditary and Congenital Disorders determine whether to approve the inclusion of a core condition in the state's newborn screening program within 1 year after the condition is added to the U.S. Department of Health and Human Services recommended uniform screening panel, and implement testing for any condition within 1 year after approval. The bill also repeals related provisions regarding the disapproval of conditions by the Advisory Council. So instead, under the bill, the Maryland Department of Health must implement testing for a core condition listed in RUSP within 18 months after the core condition is added. And there's also uncodified language requiring MDH to implement testing for infantile Krabbe disease within 1 year after HHS issues its final newborn screening recommendation regarding the disease. There were amendments that were adopted in Public Health and Minority Health Disparities Subcommittee. The amendments ensure that MDH still retains the capability to test for conditions specific to Maryland, which may not be encompassed in the RUSP, and also provide that if procurement issues prevent MDH from implementing the testing required under the bill within the required timeframes, that MDH must notify Finance and Health and Government Operations.
Okay, Bagnall.
Thank you, Madam Chair. This was a lot of work by a lot of stakeholders who came to consensus. I want to thank Delegate Hill for working with the advisory committee and also the department and the bill sponsors. These were consensus amendments, and I would move the amendments.
The amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended. The bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passed. The next one, please, is the same one.
It would be amended to form.
And this is House Bill 96. All right. The amendments have been moved and second to conform. Any questions, concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none on the bill as amended? The bill has been moved and second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? There's none. And thank you, Delegate Hill and everyone else that worked on it. Senate Bill 134, Office of the Correctional Ombudsman, Establishment and Funding. This is an appropriations bill and we're secondary. It was, I'm sorry, judiciary, and we're secondary. Lindsay.
There are amendments in your packet on page 9 for Senate Bill 134 and House Bill 297 would be amended to match. The bill establishes the Office of the Correctional Ombudsman as an independent unit of state government and specifies the staffing and duties for the office, establishes a Correctional Ombudsman Advisory Board, and establishes various reporting requirements. The bill also transfers the Juvenile Justice Monitoring Unit from the Office of the Attorney General to the Office of the Correctional Ombudsman, including positions and funding. It states the intent of the General Assembly regarding funding for the office and the focus of the activities in its first year of operation, requires the office to review potential federal funding sources, and authorizes the office to apply for relevant funding sources, and authorizes the distribution of a portion of the annual savings from the implementation of the recommendations of the Justice Reinvestment Coordinating Council to the office. The amendments from the Judiciary Committee change references in the bill from substance abuse to substance use disorder. Require savings from the difference between the prison population on October 1st, 2017, that's the baseline, and the population on October 1st of the current fiscal year, going to the Office of the Correctional Ombudsman for fiscal year 2025 only. Require the office investigate complaints of individuals, including those where the office has not determined that the complainant be personally affected by the administrative act. This allows for a witness to file a complaint, and also requires the office to act promptly on informing a complainant of a decision not to investigate, the status of an investigation, or of any conclusions, recommendations, and actions taken. The bill requires the office to submit to an agency a report containing conclusions, recommendations, and requests, and then the agency must provide a written response. The amendment changes that response time from 30 days to 45 days. And the amendments also alter the purpose of the Correctional Ombudsman Advisory Board and the membership of that board.
The amendments have been moved.
Second.
They've been second. Any questions? Delegate Shalega.
Is the fiscal note still the fiscal note, like almost $1 million a year?
The fiscal note from the third reader of Senate Bill 134 is $628,800 in fiscal year 2025, and then it does go up to almost $1 million in 2029.
So it's $1 million a year. So seems to exceed our 100,000 limit.
As I understand, the judiciary has gotten approval for that.
Thank you.
Thank you. Any questions or concerns? Oh, okay. All right, so those were the amendments. All those in favor say aye. Any opposition on the bill as amended? We're secondary.
The bill is amended.
It's been moved in second. Any questions or concerns? Seeing none, of those in favor say aye.
Aye.
Any opposition? Shalega, Chisholm, Morgan, Riley, Hutchinson, and Kipke. Thank you so much. All right, so let's move on to Senate Bill. What was that? 134. Let's do 297 is the same.
Yeah, so same bill, amendments to make it the same as what I just described.
Amendment have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing, okay, 1 second. Those are the amendments. Seeing none, on the bill as amended. It's been moved in second. All those in favor, any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Shalega, Chisholm, Morgan, Riley, Hutchinson, Kipke. Thank you so much. So Senate Bill 194, State Procurement Preferred Provider Requirement Waiver. It was favorable. It is Lindsay.
This bill authorizes the Pricing and Selection Committee for Preferred Providers to grant a waiver under specified conditions to a state or state-aided or controlled entity from the statutory requirement to purchase supplies or services first from Maryland Correctional Enterprises. It also requires MCE to report annually on the length of time between each order and delivery of supplies and services. The Department of General Services must adopt regulations to implement the bill. I also just want to point out that in subcommittee, when we were discussing this, I misstated, instead of saying MCE, I said preferred providers. So I just want to clarify for everybody that this is a waiver from the requirement to purchase from MCE.
Okay. Delegate Kerr.
Yeah, I think it's ready. Go ahead and move the bill.
Okay. Is it moved in second? Any questions or concerns on the bill? Delegate Chisholm?
Apologize. This is my
It's okay.
subcommittee, but I don't know what I was doing. So just so I fully understand, right now, when we order a lot of our supplies, from envelopes to letterhead, all of that, MCE is the preferred provider. This just says no longer the preferred provider. We can still buy from them or procure from them, but they're just not on that top level anymore. Is that correct?
They are still on the top level. It's that it allows the entity to request a waiver from the Pricing and Selection Committee for preferred providers. And that's allowed if the price of the needed supplies and services is at least 10% above market rates for similar supplies and services, or the time at which the needed supplies and services would be delivered does not meet the entity's needs.
Okay, thank you.
Okay. Delegate Olson?
Any idea, do we have any idea what the financial impact to MCE is gonna be if we pass this?
Wait, go ahead. Right.
The fiscal note did note that there could be a significant decrease in total sales for MCE. And then a potential savings for the agencies who are able to procure their goods elsewhere. So it's difficult to quantify. We did ask DGS specifically on whether or not they thought if they could quantify their projected impact, and they did not think it would be significant. That's just from DGS.
Okay, thank you.
You're welcome. All right. And this was favorable. It was moved and second. All those in favor say aye. Any opposition? Oh, Delegate Taveras, you have a question?
No, I just wanted to let Ms. Austin know about MCE, that they have plenty of money.
Okay. So let me go again. Is it moved and second? All those in favor say aye. Any opposition? Seeing none? Oh, Delegate Olson. Okay. Okay, Delegate Shalega, so you're not lonely. All right, I love it. It's how we get along here. Okay, so let's move on to Senate Bill 219, Senior Prescription Drug Assistance Program Sunset Extension. It was favorable. It is Lisa.
This is a departmental bill. It extends the termination date of the Senior Prescription Drug Assistance Program through December 31st, 2030. There are no amendments. Move the bill.
Okay, no amendment. Is moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, Senate Bill 245. It is Maryland Community Health Resource Commission, favorable with amendment. Aaron?
The bill extends the termination date for the Maryland Community Health Resources Commission by 10 years to June 30th, 2030.
All right,
2035, I'm sorry.
This was unanimous. I would move the amendments.
amendments have been moved in second. Any questions or concerns? Seeing none, those in favor say aye of the amendments. Any opposition? Seeing none, and the bill is amended. Is it moved in second? Any questions or concerns? Seeing none? All those in favor say aye. Any opposition? Seeing none? Let's go on to Senate Bill 371, Maryland Medical Assistance Program, Aaron and Bagnell.
It's identical to its cross file.
Is it moved in second? Any questions or concerns?
House Bill 189, or it's not listed.
Okay, are you okay? Okay, you want me to wait? All right, all those in favor say aye. Any opposition? Seeing none, the bill passes. Senate Bill. Oh. Okay. Okay, so. Yes, for Litigate Shalega, it's a no. And Riley, you're also a no? Okay. All right, so on Senate Bill 371, the House bill, which is for the record, what was the House bill number? 189. There were two people that were no in the committee. That was Shalega and Delegate Riley. And they're voting the same way on Senate Bill 371, correct? Hutchinson, you voted no as well on this one. Morgan, you're no? Okay. Chisholm is a no. Okay, so for the record, Senate Bill 371, the members want to vote the same way they voted on the House bill. And it's Shalega, Chisholm, and Morgan, and Riley, and Hutchinson, no. Kipke, yes. So Senate Bill, let's do like 2 minutes, okay? Senate Bill 578, professional and volunteer firefighter, Aaron.
The bill repeals the current $100,000 annual mandated appropriation for the professional and volunteer firefighter innovative cancer screening technology program. And instead, beginning in fiscal 2025, the bill authorizes the governor to include at least $500,000 in the annual budget bill for the program. It was no amendments. It was in public health today.
Any questions or concerns about this bill? Seeing none, all those in favor, may I have a motion? The bill has been moved in second. No questions, concern, all those in favor say aye. Any opposition? Seeing none, let's go to 1472. Is the same bill, favorable with amendment, Aaron.
So it does a favorable.
Oh, it's a favorable,
My fault.
okay. Bill has been moved, has been second. Any questions or concern? Seeing none, all those in favor say aye. Any opposition? Seeing none, Senate Bill 594, favorable with amendment, Aaron.
The bill requires the Maryland Department of Health to study the impact of requiring Medicaid to provide comprehensive coverage for the treatment of obesity, including coverage for intensive behavioral therapy, bariatric surgery, and any medication approved by the U.S. Food and Drug Administration with an indication for chronic weight management in patients with obesity. It was in public health today.
Okay, any questions or concerns on the amendment? Yes, it was. Okay, wonderful. All right, the amendments have been moved in second. Any questions, concerns? All those in favor say aye. Any opposition? Seeing none on the bill. The bill has been moved in as amended. It's been second. All those in favor, any questions? All those in favor say aye. Any opposition? Seeing none, the 986 is the same bill. It's been moved in second, the amendments. It will be amended to conform to what we just did. Amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. Senate Bill 615, we heard it today.
This bill requires the governor to annually proclaim September 30th as Maryland Veterans Suicide Prevention Day and establishes specified details of the proclamation. No amendments.
Any questions or concerns? Oh, we did not? Okay, so 986. 594, we did do it, but we'll do it again. We did. Okay, so the amendment on 594, 1 second. 594, may I have a motion on the amendments? No, we're gonna do it again. Have a motion on the amendment. Moved in second. Any questions or concerns? Seeing none. On the bill as amended on 594 has been moved. And may I have a second? It's been moved in second. Any questions? Seeing none. All those in favor say aye of 594. Any concerns? Any objection? Seeing none, it passes. So now where are we? 615. No, we did it. Listen, 615. We did it already, did we not? I didn't get to vote because I was interrupted. Okay, so on 615, may I have a motion? It's been moved in second. Any questions on 615? Seeing none. All those in favor say aye. Any opposition on 615? Seeing none, it passes. 723, it is favorable with amendment. It is Aaron.
This bill prohibits a person beginning January 1st, 2025 from selling, distributing, or offering for sale baby food that contains toxic heavy metals that exceed the limits established by the U.S. Food and Drug Administration. A person may sell, distribute, or offer for sale baby food manufactured before January 1st, 2026. There is an amendment that has been added that clarifies the definition of proficient laboratory to include the analytical method to be used by the lab and the requirement to use an independent proficiency test.
Are there any questions or concerns about those amendments? Seeing none, can someone move the amendments? The amendments have been moved and second. Any questions? Seeing none? Danny's bill. Yes, it's the same. Yep. So on the amendments, all those in favor say aye. Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions, concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, let's move on to 944. Aaron.
The bill repeals the prohibition against a related penalty for selling or offering for sale a non-latex condom by means of a vending machine or other automatic device. Instead, the bill prohibits a person from selling or offering for sale a natural membrane condom by means of a vending machine or other automatic device. There is an amendment that's been added that exempts the prohibition on a person from selling or offering for sale a natural membrane condom by means of a vending machine from existing criminal and civil penalties for violations of Title 21, Subtitle 2 of the Health General Article.
Okay, and we voted on this bill before.
Yes, and this is just Senator Kelly, when she testified on the bill, she said that where that prohibition was placed in the code inadvertently subjected it to criminal and civil penalties for violating, and this would exempt that.
Okay,
So
are
it
there
would
any
not-
questions on this bill, on this amendment? Yes. All right. Can someone move the amendments? We moved in second. Any questions, concern? Seeing none, of those in favor say aye. Any opposition? Seeing none on the bill as amended? To move in second. Any questions or concerns? Seeing none, of those in favor say aye. Any opposition? All right. On Senate Bill 991. Actually, you know what? Let's hold 991 and 1084 and let's just. Okay, 1084. So let's do Senate Bill 1084.
Although the cross file, it was unanimous vote.
The bill has been moved in second. Any questions? All those in favor say aye. Any opposition? Seeing none, let's just hold 991, okay? Thank you. Yes.